To control the overcharging of blood in hospitals and private blood banks, the central government has decided to waive all fees except reasonable processing charges. The choice was made in light of the perspective that blood is not meant for sale, which led to the issuance of an advisory to all blood centers throughout India. The Central Drugs Standard Control Organization, which is the apex health regulatory agency of India, has asked all states and union territories to follow the latest decision and charge only processing fees which were fixed by the government in 2022. According to the letter issued to states and union territories accessed by News 18, the decision was taken during the 62nd meeting of the Drugs Consultative Committee, the panel of experts, who opined that blood is not for sale. It is only for supply and only processing cost may be charged by the blood centers. It was opined to issue an advisory to all blood centers regarding revised guidelines for recovery of processing charges for blood and blood components. The government has instructed drug regulators across India, adding that you are requested to direct all the blood centers under your jurisdiction to adhere with the revised guidelines 2022 for recovery of processing charges for blood and blood components. Let's understand why this move is important. According to medical experts, the move is patient-friendly, especially for those who undergo regular blood transfusions due to blood disorders such as thalassemia, sickle cell anemia, or patients undergoing surgery. In such cases, blood donation by relatives or friends is not always possible. The decision will help in curbing the practice of overpricing undertaken by some corporate hospitals as well as private blood banks. For instance, a patient suffering from thalassemia, which is a genetic blood disorder, survives on regular blood transfusions and they undergo blood transfusion twice a month with the requirement of at least 4 units of packed red blood cells. Paying charges for seeking blood becomes a big financial burden on such patients and their families. Medical experts appreciated the government's decision and said that the processing fees fixed by the government is reasonable and more than sufficient for any healthcare premises to recover the expenses incurred. On an average, private hospitals and blood banks charge Rs 2,000 to Rs 6,000 per unit in case of no blood donation. In case of blood shortage or rare blood groups, the charges exceed Rs 10,000, sometimes even if a blood donation is made. Moreover, processing fees is always charged, irrespective of blood donation, which varies from hospital to hospital and center to center. However, under the new guidelines, only processing fees can be charged, which ranges between Rs 250 to Rs 1,550 for blood or blood components. For instance, while dispensing whole blood or packed red blood cells, fees of Rs 1,550 can be levied, whereas for plasma and platelet, the charges would be Rs 400 per pack. The government rules also fix other charges for running additional tests on blood, including cross-matching and antibody testing.